Do not touch PRP until you nail this consultation strategy. One flawless conversation can ignite patient trust, boost your cash-based revenue, and give you freedom from insurance madness. One sloppy conversation kills all of it. And this is where you take control. I'm Dr. Ariana DeMers, the queen of business orthobiologics, and I am leading the way in orthopedic surgery innovation, shaping medical practices for success. I will give you the PRP consultation blueprint that turns uncertainty into enthusiasm. Learn how to build trust instantly and simplify platelet science, as well as destroy objections before they even form. And then finally, close with conviction. When you walk into a PRP consult with this structure, you move from just another doctor to a trusted guide in the patient's orthobiologic journey. So how do I structure an effective orthobiologic consultation for my patients? So let's get into the framework of what makes orthobiologic consultations profitable, ethical, efficient, and most importantly, deeply rewarding for both the patient and the doctor. So step one, you have to set the stage, giving authority with empathy. So start strong, look your patient in the eye, and really recognize their frustration. You've tried everything. You're still hurting. You deserve better. And that validation disarms their skepticism. They finally feel heard. This first 90 seconds is where the patient decides whether they trust you. And you want them thinking, finally, someone gets it. This lights their curiosity, puts their guard down, and now they're ready to listen. Step two is know what matters for them, their story, their wins. Ask those powerful questions. What does success look like for you? Why now? Why today? Because reality is that patients are not in your office buying PRP. What they're buying is a return to running, holding their grandkids again, swinging a golf club without pain. And if you can identify the emotional goals behind the clinical problem that they're presenting, the shoulder pain or the knee pain, then you can align your orthobiologic treatments with their personal mission. Step three, please explain orthobiologics like a human. Please don't say what it is from the textbook. You can give them ideas like platelets are repair workers, or, stem cells are like general contractors. And we concentrate the best ones and send them straight to the site of injury. And make sure you're not just talking at them, telling at them. Show them, put up a model, point to the tendon, help them see the big picture of how their cells affect healing in their tissues. And so when they understand how this is actually going to help them achieve their goals, then they get to own the decision. When they don't understand or there's uncertainty, the reflex answer is no. So step four is set real expectations with fierce honesty. You can just say that clearly. Listen, this isn't magic. This is medicine. This is just harnessing your body's own reparative mechanisms to heal you. Some people feel better in 2 to 3 weeks. Some need 2 to 3 treatments. Healing takes time. I always tell my patients, we can't rush Mother Nature. She does not appreciate it. And they seem to understand that. You can't make a carrot grow any faster than it grows. You can't rush Mother Nature. You can't rush the human body to heal faster. And when we have our patients who respect that timeline, they become our biggest success stories. Those who expect instant miracles are going to be your loudest critics. So if you set that expectation ahead of time, that it is not the McDonald's drive-thru, that it does take time, you control that outcome with proper expectation setting from the outset. So step 5 is handling objections before they even ask. And you've got to hit the big ones right on the head, right? Effectiveness. Is it effective, right? There is strong clinical evidence for PRP in tendons and mild to moderate arthritis. I stay updated on the latest data, and I would never recommend anything that does not help patients. And you can go farther into the science if that's what they're looking for, but the majority of patients just want to know if it works. The next one is pain. They're worried it's going to hurt. I would say the majority of my patients, we use numbing medicine. It's quick. You walk in and out the same day. You're going to be sore for about 48 hours and then get back to life. And we also try to tie that with the fact that we understand we do some blocks and some nerve blocks to make sure that they don't experience too much discomfort during the procedure as well. The third is going to be safety. And this is a big one. The people who are not in the medical field are always worried about putting extra stuff in their body. And so what you can tell them is, listen, it's your own cells, your own blood, your own growth factors. Of course, your body recognizes it. All we're doing is concentrating it and giving it back to you. And then finally, the cost. And this is always going to be a worry for patients. And I am happy to throw the insurance companies under the bus. I said, unfortunately, your insurance companies don't see this as beneficial. And so they are not choosing to cover these beneficial treatments. Insurance is slow to adopt innovation. And when you worry about those types of things and you think that's strange that the insurance company wouldn't cover it, all you have to do is follow the money. The insurance job is to make money for their shareholders. It is not actually to take great care of you with cutting-edge treatments. And so, most patients choose orthobiologics, PRP, because they want treatments that help them heal, not just mask the symptoms. And patients get that. That they're really looking for something that is a solution, not just a Band-Aid treatment. And that transparency equals trust. And when they trust you, they can't help but say yes. Step 6, bring real results, right? Patients want to hear the stories. The stories stick with them. They remember what has worked for other patients, that an athlete avoided surgery and returned to their highest level of play, that a weakened warrior with elbow pain is back on the court, that a 60-year-old postponed knee replacements for 6 years. Just short, honest, relatable stories that they can kind of hang their hat on, especially for their condition. And the patient needs to see themselves in that victory. They need to see that it's worked for others just like them. Step 7, present your plan like a leader. Please don't end with, so what do you think? End with a roadmap. Please tell them, hey, listen, you are a great candidate for this treatment. Here's how we start. We expect at 6 weeks, X, Y, and Z. Here's how we support healing with laser therapy, optimization, rehabilitation. And then clear steps will help remove that fear, that uncertainty. When they're uncertain, that kills action. So if we remove that, they can't help but move forward. Step 8, close with confidence and hope. Just let them know you are not stuck. We have a real path forward. I would love to help you reclaim the activities that you miss. No pressure, just partnership. And that burnout, your burnout, fades when you see patients genuinely excited about healing And that joy is contagious. It spreads to your other patients, to their families, to their neighbors. So a great PRP orthobiologic consult is simple. All you have to do is show your patients you understand their pain and you know exactly how to help. You ask them what they want to get back to and then tie the treatment directly back to their goals. Finally, you walk them through the science at a very high level that makes sense, not too many facts, not too many science-heavy explanations. Then set real expectations, answer their concerns upfront with facts, and then share outcomes that give them confidence. Finally, when you give them a clear plan and let them feel your commitment to their recovery, they can't help but say yes. So, if you're serious about scaling your orthobiologic practice and escaping burnout, please book a consultation, skip the trial and error, and subscribe for strategies that put you back in control, get your patients better options, and get your life back on track.